Welcome everybody, and we're like so excited to have you here for a continuation of our original event that we had in Waco, Texas on vaccine education. Throughout the event, it became super clear that a lot of you guys are interested in a topic that we are as well. And really that is ultimately all about how do we help our children to thrive, not only to have amazing immune systems, but just to like thrive in general in every way, shape, or form as a child. So I'm so excited for us to start this conversation with Dr. Seth Osgood. He has been a friend of ours for over 2 years now. Well, actually started as our doctor for my husband when he was diagnosed with Graves' disease. And I just think like how things would have changed if we would have known some of the principles that Seth is going to talk about now when we were much younger, or if our parents would have known, things would have been so different. But you know better and then you do better. And so anyways, I'm super excited for him to teach tonight specifically on the importance of gut health and what that looks like specifically with children and how we can support them to thrive. So thanks, Seth, for joining us. And I'm so excited to hear all that you're covering.
Hi, well, thank you, Kristen, for that wonderful introduction. I'm glad to be here and really excited to talk about a topic that's near and dear to my heart, the autoimmune gut connection. As many of you probably know, the gut is absolutely essential for optimal wellness, and we're going to see how autoimmunity is just skyrocketing, not only in adults, but also in children. And there's a lot that we can do preventatively and when the autoimmune disease is already diagnosed to really not only prevent progression, but also reverse what's already there. So I'm excited to jump into it, and we'll just get started with everything. So I just wanted to start off with a little story about myself and why I'm passionate about functional medicine and healing in general. So I grew up in a small town in Vermont, and I came from what I like to refer to as an IBS home. 5 out of the 6 people in my house had digestive issues, and honestly, that is just the way we grew up. That's what we knew to be normal. My mom was the one probably who struggled the most with her digestive issues. And she was like a lot of my patients who had been to multiple doctors, multiple specialists, just in search of some answers, because not only was she having problems, but the majority of her family was. And unfortunately, she just kind of got blown off, was given the diagnosis of irritable bowel syndrome, or IBS, and just told that, this is how life was going to be. You need to take over-the-counter medications like Imodium or Kaopectate or different things to keep your symptoms under control. And that's just life. So that's how we grew up. That's what we thought was normal. We went through Imodium in our house like Tic Tacs. And I just remember how uncomfortable it was, what that intense cramping felt like, just fighting for the bathroom after dinner, going on family trips and having to focus in on where each restroom was. And that was just, it was no way to live, but we honestly didn't know any better. And that's how we went through life. One of the things that really sticks out when I was little is, I remember the first time I actually saw my mother break down. It was actually because of something that I did. She was having an IBS flare, and I remember her walking out of the bathroom. I was probably about 12 at the time, and she was upset, she was in tears, and she was mad at me because I took the last Imodium, and she was in the middle of an acute flare, and she had no way to relieve her symptoms. And we kind of lived in the sticks, so there was no quick answers there. But what that really opened my eyes to is not that I was frustrated about the situation. It just kind of really hit me hard, and I realized that this syndrome, this irritable bowel syndrome, was more than just digestive symptoms. It was more than just having cramping or having bloating or having fluctuating bowel movements. It affected her as it did us emotionally, physically, and mentally. It really encompassed all aspects of our health. And again, unfortunately, we just lived like that and until later, which when we figured out there were some solutions. And I remember, so I got involved in healthcare. I actually started out as a paramedic and moved down to Austin, went back to school and became a nurse and then a nurse practitioner. I remember I was getting ready to graduate my nurse practitioner program several years ago. And I got a phone call from my mom, and she said, hey, you're not going to believe this, but my irritable bowel syndrome is gone. I have no symptoms whatsoever. And I was thinking to myself after just going through this conventional program, oh my gosh, what did you take? I want that medication because I want to feel better myself. She goes, you're not going to believe this, but I did not take any medication. I actually found a local doctor who practices what she said was functional medicine. And we did an elimination diet. And what we realized is that I have food intolerances, and that was the root cause of my digestive issues. And she had problems with gluten and dairy. And I was really just blown back by that, because here I had been through, lots of training, multiple years of school, and we never once talked about the impact that food has on irritable bowel syndrome, or that food sensitivities could have on irritable bowel syndrome or health in general. So right away, I had to try it. So I did an elimination diet that was similar, and found out that I was also sensitive to gluten and dairy. And everybody in my house, 5 out of the 6 of us who had problems, had some type of food intolerance. And now, our digestive health is much better, and we feel better, and we can function as normal. And it all boiled down to foods. Now, it's not that simple for everybody, but it just goes to show the power of looking outside of the box and looking at your environment and looking at your lifestyle to see how that's impacting some of your symptoms. And what's ironic about it, as you can see here in the picture, why I threw this picture up, this is their farm. This is their dairy farm. So here we are growing up on a dairy farm, and nobody once asked us about what we were consuming. So that is our story, and then what happened from there is I just dove into functional medicine, full bore, sought out multiple trainings, got certified through the Institute of Functional Medicine, worked in primary care for a little bit, that in a practice that used functional medicine. And then I was lucky enough to work with Dr. Amy Myers for a couple of years in Austin, where we worked with people from around the world with complex health conditions, helping them to overcome them using holistic natural methods. And it was just a great experience. So recently I opened up GrassRoots Functional Medicine. We wanted to move my 4 kiddos back to spend some time on the farm. And so we opened up GrassRoots, and now I practice in West Lebanon, New Hampshire, and also in Austin, Texas, where I see patients once a month. So that's just a little bit about me, but I wanted to, start off with a quote by a pretty smart man. Most of you know the father of medicine, Hippocrates, and I think this was back in 1400 BC or somewhere in that range, where he said, let food be thy medicine and medicine be thy food. And this is a concept that I wholeheartedly believe to this day. And I think that as a medical society, we need to start thinking along these terms. Here is the father of medicine who developed the Hippocratic oath that every doctor takes, but where the food is the last thing most medical practitioners are actually thinking about. They jump right to the pharmaceuticals, but there's so many healing powers with food, and it's just amazing. I see it every day. It can be life-changing. He also said that all disease begins in the gut, and this is another concept that is proving to be very true. And even the conventional world is starting to get up to speed with this. We're just brushing the surface with digestive health, but what we're finding is just pretty amazing. And that's what we're going to go into in more detail today. So I like to talk, the gut, again, when I have a complex patient, someone who is very sick, someone who has been to all of the specialists and multiple doctors, has seen, everybody that they can possibly see, and they end up in my office, which is not an uncommon occurrence. One of the best places that I like to start to get good traction and good results is with the digestive tract. So, what we know about the gut is just how complex it is. In fact, they're now calling your gut, or people are calling your gut the second brain, because it's got its own enteric nervous system, which contains millions of neurons, and it contains more neurons than the spinal cord and the peripheral nervous system, all in your digestive tract. The gut also produces, up to 90% of the body's serotonin. So, how many people do you know on an antidepressant? Almost everybody is on an antidepressant these days, because everybody's mood is in the pits. But before you start jumping to the SSRI, which increases the serotonin your body already has, or it recycles it, so there's more readily available, we need to start thinking about what is happening in the gut where this serotonin is actually being manufactured, and does the body have the nutrients in the macronutrients and the micronutrients to make these neurotransmitters? Because it just blows, it's amazing to me how many people will get off of their antidepressants after we get the gut under control. And there's just, again, like most drugs that are out there, there's so many side effects. So we need to be thinking about why these things are going on, and looking at the physiology and optimizing the physiology, because it's just amazing what the body can do on its own if you give it what it needs and take away the things we tend to add in that are problematic. And then, of course, 80% of your immune system is in your digestive tract. And this is, again, what we're going to focus in on for the talk today, talking about specifically about autoimmunity. This is a pretty incredible design. I'm a firm believer, that our creator made things perfectly, and we tend to try to doubt that at times. But here we are with 80% of our immune system in the gut, which is an excellent location, being that the majority of the junk that enters our body comes through our mouth. So again, when we're dealing with inflammation, when we're dealing with autoimmunity, when we're dealing with problems that are immune system based, we have to be looking at the digestive tract. A stool test, a comprehensive stool test, which I'll show you in a little bit, is one of the most effective tools that you can use to optimize your immune health, because you will be surprised, even if you're not completely symptomatic, how many bugs and critters and deficiencies and imbalances are going on in the gut in someone who is suffering from immune dysfunction. So we got to keep that in the back of our minds. Autoimmunity is the topic of today, in the connection with the gut. But autoimmune diseases are just growing at phenomenal rates. I mean, we're seeing, it seems like every month they're naming a new autoimmune disease. There's over 100 of them now that have been named. And it's important to understand what an autoimmune condition is to understand how we need to treat autoimmune disease. So autoimmunity is simply the process of your immune system, which is supposed to protect you, going rogue, getting overwhelmed, and for some reason flipping a switch where all of a sudden it says, hey, that healthy tissue, that human cell, doesn't look quite right to me, so we're going to attack it and get rid of it. So it's when your immune system goes rogue and attacks normal tissue, that is what happens with autoimmune disease. And it can happen in multiple places. When it's happening in a brain, that can be MS or Guillain-Barré, or it can happen in autism. When it's in the thyroid, they're looking at Hashimoto's or Graves'. It can happen in the bones, it can happen in the gut, it can happen in the nerves, it can happen all over the body. Almost, every system can be affected by immune dysfunction and autoimmunity. Even cardiovascular disease, we're starting to learn more and more about that, how there's definitely an autoimmune component there. So we need to be thinking about why this is happening, because when you look at the incidence of autoimmune diseases, it's just blowing up. We have done an excellent job with modern medicine in getting rid of infectious diseases, for the most part anyway. You can see, rheumatic fever, hepatitis A, mumps, measles, tuberculosis. Those things are pretty much down next to nothing these days, which is excellent. So you don't want to discount the effects of modern medicine, but unfortunately, we're seeing the opposite when we look at autoimmune conditions. So you can see back in 1950, 1960, these autoimmune conditions were next to none, and now we're seeing this huge surge that unfortunately doesn't seem to be slowing down, because the main treatment for autoimmune diseases right now is to shut down the immune system, shut down that autoimmune attack. But when you shut down the immune system with some of these hardcore pharmaceuticals, you're also increasing risk for other problems, opportunistic problems to pop up, like cancer and and a whole host of other things. If you look at the side effect profile of Humira, for example, which is the #1 selling pharmaceutical right now, it'll blow your mind. And the other thing is, these things are super expensive. I just read an article saying Humira, used for autoimmune and inflammatory diseases, is costing people about 38 grand a year. So this comes at a big cost, not only to the quality of life, but these diseases are costly from a financial perspective as well. So when we're looking at autoimmunity, what we know is that it's not just popping out, of the woods and a problem all of a sudden. There's factors that contribute to it. We also know that it's not just genetics. Genetics plays a role, and it's an important role, but there's something that impacts genetics, something that, again, flicks that switch that tells bad genes to turn on and go down that autoimmune pathway, and usually that is the environment. So there's kind of a triad that we look at with autoimmunity. There's genetics, there are triggers or stressors, and those can be chemical stressors, physical stressors, or emotional stressors. And you can see in this image here, it can be toxins, mold, gluten, bacteria, parasites, viruses. These are just a few. Hormone imbalances. And then we've got intestinal permeability issues or mucosal immune issues that will pop in and cause problems. So I always tell my patients, and I work primarily with digestive issues and autoimmune issues and chronic infections, and 9 times out of 10 we're seeing people come in or get diagnosed after a big stressful event. So we definitely want to be focusing on diet and reducing our toxic exposures in the environment. We want to be focusing in on just cleaning up our lifestyle in general, but we have to make stress a priority, because I'm a firm believer that is one of the biggest culprits that sets people off and sets these genetics down that path of dysfunction. So now I want to talk to you a little bit about the microbiome. So this is where we like to put a lot of attention when we're trying to optimize healing in someone's body and someone's gut. The microbiome is massive. In fact, the bacteria in the gut outnumber the cells in the body at least 10-to-1, and they play a whole host of important roles, and they've got their fingers into multiple body systems, which we'll mention here in a minute. But the microbiota are important for reducing pathogenic load or opportunistic bugs. Opportunistic bugs are bugs that, if they're high enough, they can create a problem. But a lot of times when the immune system is strong enough, when the microbiota is strong enough, they don't present with any issues. It's important for promoting healthy intestinal barrier, which we'll talk about here in a minute. And then it helps regulate immune balance. The T regulatory cells, which play a big role at regulating that immune response, supports beneficial microbes or other beneficial microbes. So having healthy flora helps other flora thrive. And then they break this. The microbiota also break down a lot of the food we eat into other beneficial byproducts that are important for in general inflammation and overall health. So here we're looking at microbial fermentation and the production of short chain fatty acids. So short chain fatty acids are very, very important. That's what you're looking at with the propionate, the butyrate, and acetate. These guys, as you can see here, play a huge role with reducing inflammation and controlling immune function. They come from, short chain fatty acids come from eating foods that are high in resistant starches, like tiger nuts, green bananas, oats, and a whole host of other things that we will recommend that you don't get digested and absorbed in the small intestine. They travel to the colon, where the good flora are supposed to be, and then the good flora, if they're there, will ferment them, will process them into the short chain fatty acids, and then you'll get this production, which will go into the cells and help maintain healthy cellular function, across the board in multiple aspects of the body. So I always tell people that this is like the gasoline. Short chain fatty acids are like the gasoline that run the engine of the cell in the gut. So you need to fuel the gut with the right foods to produce these short chain fatty acids. Dysbiosis is probably one of the biggest culprits with leaky gut and with inflammation, especially with our modern lifestyle. And dysbiosis is just a fancy word to say that the microbiome, the bugs in the gut, are just all wacky and all over the place and not balanced. It typically means that you've got too much of the bad guys and not enough of the good guys. But this is a big problem for most of my patients that come in, and it's amazing what kind of results you can get simply by addressing dysbiosis. So here are some of the causes of dysbiosis that we will test for or we will assess for when going through a comprehensive health history. Pathogens are a big one, and that can be fungal overgrowth, that can be bacterial overgrowth, that can be parasitic overgrowth, that can be viruses. A whole host of different pathogens can cause imbalances, but one of the big issues that we see are the drugs. Again, everybody and their brother goes to the doctor for a sniffle and they're getting thrown on antibiotics, which is important when you have a serious infection, don't get me wrong, but when you're dealing with something that is self-limiting, that often is viral, antibiotics aren't going to be much help, and they can cause a lot more harm than good. And if you do have to get on antibiotics, make sure you're following that with probiotics. You're and taking a good probiotic, high quality probiotic, which I think everybody should be on in general, at least 2 hours after each dose. PPIs are getting more and more of a bad rap, unfortunately, these days with chronic disease. We're associating PPIs, or proton pump inhibitors, which help stop gastric acid production or block gastric acid production in the stomach, with osteoporosis, cardiovascular disease, cognitive issues, nutrient deficiencies, a whole host of things. And it makes sense, right? When we're trying to, the stomach acid is very important, and its role is to break apart food so we can absorb nutrition through the gut into the system so it can be distributed to all the cells in the body. But when we block that production, it leads to dysbiosis, it leads to malabsorption, and a whole host of problems. Inflammatory foods is a tricky one. Again, you've got your main culprits like sugar and gluten, but also there's other foods that may be healthy for some people that are inflammatory for others, and that's important to identify that. There's no perfect diet for anybody. I know everybody likes to push the fad diet, but of the week, but really you have to individualize and figure out what diets are best for each person. And there's testing that helps with that, but realistically, I think the best culprit is to eliminate and reintroduce. Again, immune dysfunction, insufficiencies in enzymes, constipation's huge, motility issues are huge. So most of us are sedentary, we're not moving enough, we're eating processed foods, we're stressed out to the max. Our guts are not moving as efficiently as they should, and that sets you up for a whole host of different things. And you can see stress and toxins also playing a big role. If you have dysbiosis, you will have inflammation, and when you have inflammation, your gut, the integrity of your gut lining becomes breached, and your system becomes overwhelmed, and that leads to problems with immune dysfunction and autoimmunity. So this is talking a little bit about that concept about leaky gut. And I know leaky gut is kind of a hot topic. Again, another buzzword out there. It's important to understand that everybody has a little bit of a leaky gut. If you didn't have a little bit of a leaky gut, your nutrition wouldn't be able to get absorbed in your bloodstream and distributed throughout your body. So we're looking at excessive leakiness or breach barriers where larger molecules are sneaking through, undigested molecules are sneaking through this epithelial layer, which there's only one layer of cells here that separates the food that goes through the intestinal lumen from the bloodstream. So as you can imagine, that one layer of cells is easily prone to damage. So when you have food allergies, high stress, hormone imbalances, antibiotics, low enzymes, blood sugar issues, pregnancy, a whole host of other things will affect the integrity of this intestinal lining. Then pathogens and undigested food sneaks through, gets into the bloodstream. The immune system, which is constantly on patrol, says, hey, that shouldn't be there. We need to get rid of it. So you mount this immune response that happens over and over again. Eventually, the immune system becomes burdened and says, you know what? I don't know what to do with this anymore. I can't attack everything. I'm just going to attack everything I see. So then what happens is you start to attack things that you normally shouldn't, and that's where autoimmune comes in. You start to attack your thyroid in Hashimoto's or Graves'. You start to attack your joints in rheumatoid arthritis, or your brain in MS or spinal cord. So this is one of the key players, and we can test for this. We can tell you if you have leaky gut. A lot of times we just assume it's there when we're dealing with an autoimmune condition. And the fix to this is not any supplement, okay? A lot of people, of course, we use supplements to help promote healing in the intestinal lining, but we have to be thinking about why. We always have to go back to that simple question of why. If we don't fix the stress, if we don't fix the antibiotics, if we don't fix the infections, if we don't fix the blood sugar issues and so on, no matter what nutrient or what supplement you throw into the mix, you're not going to see the progress that you're looking for. So you always have to be addressing the why. Here are some of the diseases associated with the microbiome: acne, diarrhea, asthma. These are all research-based, by the way. Autism, autoimmune disease, cancer, dental cavities. You can see there's a whole host of things here that have already been linked with the microbiome or problems with the microbiome, and this number is growing as well. So I want to give you a quick case study about Marissa. So Marissa came to my clinic. Her mom was actually pretty desperate and frantic. She is a conventional pharmacist. She's heard about functional medicine from her sister, who I actually worked with, and we helped put her Hashimoto's into remission. But she talked to her sister. Her daughter, 17 years old, is getting ready to go to college. And unfortunately, she was suffering from some pretty significant health issues, and her mom had no idea what to do. They'd been to all of the conventional doctors, had all of the conventional tests, and Marissa was still suffering from a ton of symptoms: extreme bloating, indigestion, anxiety, multiple food intolerances, unexplained weight gain. And she is a very active young girl, and she just was still gaining weight, which was related to inflammation and just not having the energy she wanted to. And then here you're seeing, one of the biggest things, the hallmark sign here that really, where they knew something was wrong. She was vomiting every single day. Every single day she had nausea and vomiting when she ate anything that contained the smallest amount of fat. So of course she went to her GI, they looked into the gallbladder issues, they looked into all those conventional things, couldn't find anything. So they were stuck. She was willing to do anything. Even though she wasn't familiar with functional medicine, she took a leap and came in and saw me. And I'm really glad she did, because Marissa, you'll see, did really well. But as you can see here, she actually went to her PCP, and the PCP told her that she was bulimic. So here this girl is 17 years old, coming and vomiting every day, and her doctor is telling her that she's bulimic, and she knows that something's wrong. She knows that this would be the last thing that was going on. She went to a couple different gastroenterologists, had the full workup. And the other pertinent thing to know about her, she had a family history of autoimmunity. Like I said, her aunt had Hashimoto's, or autoimmune thyroid. So what did we do for Marissa right off the bat? We put her on an anti-inflammatory diet, eliminating most of the foods that we know can cause digestive issues. Now, this is not a diet that I recommend long term, but it is in the short term, so we can reduce inflammation and improve healing in the short term. And I actually did a stomach acid challenge. So that's one of the things that I see in a lot of people with nausea, especially if they have nausea with food or nausea with supplements, or reflux in general, is actually the problem of low stomach acid. So most people go to the doctor and they get put on these blockers, which actually stop stomach acid production or slow it down significantly. But what we did here is we actually added it in. And the thought behind this is, a lot of people, when they're not breaking down their food, when they're not digesting it appropriately, it just sits there and it kind of ferments and doesn't move forward. It doesn't, it's not getting broken down and absorbed effectively. And then when it sits there and it ferments in the gut, other acids are produced, which lead to a lot of those uncomfortable symptoms. So we actually added in HCl with her meals, along with bile acid support because of her symptoms with fat. And then we did a bunch of comprehensive blood testing and functional medicine testing. We did a breath test because of the bloating to rule out small intestine bacterial overgrowth or stool or SIBO, and then also a stool test as well. So what we found in her overview is, again, she did have hypochlorhydria. That the HDL challenge was very effective in the sense that she did not feel any burning, which tells us that she was very low. She was iron deficient. She was B vitamin deficient. She also had very low amino acids, which suggests, again, she doesn't have the acid to break apart her proteins in her stomach. She had bile acid insufficiency. We found that on the stool test, and then multiple food intolerances, and then she did have small intestine bacterial overgrowth. And here's the key with the autoimmunity. She had a low positive ANA. So an ANA is anti-nuclear antibody, and this is just it's a test that we look at to screen for general autoimmunity. It's not real specific, but it tells that her immune system has targeted her own cells as a problem. So she's got this family history. She's got this gut imbalance. We know that if we don't do something, she's most likely going to progress down that autoimmune pathway. So where's Marissa now? So after implementing treatment protocol and getting her SIBO under control, absolutely no nausea and vomiting, zero. She is eating food like normal, no vomiting at all, going from every day to none. Skin's completely clear. She also had some issues with acne. Again, we always say the skin is a mirror image of the gut, and it always very frequently will clear up when you get the gut under control. Gas and bloating gone, weight stabilized, energy back, mood is improved, cognition and focus has improved, and that was a little bit of an issue as well. So after, here's her mom, Shorta, sent in an email to me. After a year or more of increasing misery and worsening symptoms, she finally began to feel better. Last week, she got to go to college. I cried a few sad tears because I was saying goodbye to her, but I cried even more happy tears because she finally feels great and has been symptom-free. My goal was to find answers for her by the time she left for school, and thanks to GrassRoots, we have a happy, healthy girl. I couldn't be more grateful. So just a great story. This did not take very long either, but she changed her life dramatically. And SIBO is a big cause of the leaky gut. So, this is something that, especially with IBS, we see this as a big problem. And this is simply having too many bugs in the small intestine, where most of them are supposed to be in the large intestine. And that can happen for a whole host of reasons. But we know that small intestine bacterial overgrowth is associated with a lot of systemic issues. So again, going back to the gut affects most aspects of your body: rosacea, depression, asthma, eczema, acne, rash, fatigue, joint pain, weight loss. All of these things are associated with SIBO. And again, you want to fix the SIBO with appropriate treatment to reduce that overgrowth, but you also have to think about why it's there in the first place. Here's another quick case study. This is Michael. Michael was 11 years old. And he came in with irritability, rapid mood swings, severe OCD, motor tics, muscle spasms, and muscle aches that were migratory. That is a key factor here. And then sensitivities to sound and touch. He also had a host of digestive issues. His medical symptom questionnaire was 55. So every time a patient comes into the clinic, we have them fill out a medical symptoms questionnaire to rate where they're at. And so we can track where their symptoms are most prominent and make sure things are getting better on subsequent appointments. So they fill this out, they number it 0 to 4. He had a total of 55 based on his symptoms. So he was a perfectly healthy young man, throughout his early years of childhood, but at age 5, things changed. So at the end of the summer of 2013, he had an acute onset of irritability, feeling overheated. He had these hot flashes in the back of his neck, 5 years old, stomach aches, and intrusive thoughts. Completely out of the norm for this kiddo, otherwise very, very pleasant. After the summer of 2013, like I said, flick of a switch. 2014, rage got worse, headaches got worse, and then he developed this peculiar rash that just would not respond to any specific treatment. In 2015, he had explosive involuntary movements, horrible sensations in his groin, and he would do these obsessive behaviors with excessive cleansing. He developed eczema, food allergies, loss of bladder control. He went to the neurologist, and the parents, who are awesome, found out about PANS, which is pediatric acute onset neuropsychiatric syndrome, and that has an autoimmune component to it, autoimmune component in the brain, in the basal ganglia. But the parents did some research. They had some ideas that this may be going on, and went to the neurologist, and they just told him that it doesn't exist. They diagnosed him with Tourette, started him on antidepressant, and sent him on his way. One of the key things about his history back in 2013 is, where was it? Down here is at the summer of 2013. This is something I went into in detail. He actually got bit by a tick. They went on a trip to Ohio and Pennsylvania. He got bit by a tick the summer of 2013. So that kind of makes sense with the picture of migratory joint pain, which is common with Lyme. But 2016, again, everything just kind of got worse. He went to a psychiatrist, increased his Paxil. He started having self-harming behaviors. This was at age 9 years old. I tried another antidepressant, and they actually had to hospitalize their 9-year-old in a psychiatric hospital due to his behavior. And they started him on antipsychotics later on. Again, multiple tests, colonoscopy, endoscopy, MRI, CTs. They even tried some dietary modifications the parents did on their own, which actually helped a little bit, which was awesome on their part. But it continued with bladder control issues. And again, he was at 10 years old at this time. So really struggling. When we look at the family history, it's again important to see the history here. Mom's got thyroid, maternal grandmother has thyroid issues, paternal grandmother has thyroid issues, father's got eczema. So we can see when you have a family history of thyroid issues, likely that it's autoimmune, but you also see with eczema and hyperimmune response. So immune dysfunction, it increases the likelihood of having some autoimmunity going on. So what we did with Michael is we did functional and conventional testing again with him. For those, PANS is a big problem with a lot of kiddos, and it can be triggered by a lot of things. PANDAS is another similar disorder that's triggered by strep. So we wanted to see if there were any issues going on here as far as strep goes. So we did an anal and oral swab, and we looked at it in the stool. We did a comprehensive nutrition profile to make sure he has the building blocks for his immune system to function. And then we did food sensitivity testing, and then we did a comprehensive Lyme and co-infections test. Put him on dairy-free, sugar-free, gluten-free, dye-free diet, and then obviously pushed the basics, physical activity and stress management. What we found is that he was intolerant to gluten, dairy, and he had immune suppression, low IgG, which is an immunoglobulin, a protective protein that supports your immune system, and IgA, which is another immunoglobulin specifically in the gut that really tells us a lot about the immune function. And then severe amino acid deficiencies. And this is a big problem for a lot of people. When you don't have amino acids, you don't have those foundational building blocks, which make neurotransmitters, which support detoxification, which control immune function. So by simply building these up, it can really have a drastic impact on symptoms and improvement. He also had low neurotransmitters, which likely was related to gut dysfunction and amino acid deficiencies. He had evidence of Lyme exposure. The test was not cut and dry, but he had Lyme positive bands showing that he had been exposed, at least in the past. It could be playing a role. EBV exposure, Epstein-Barr virus, and then he had an active mycoplasma infection. So again, this kind of really pushed that PANS diagnosis into my mind, and we went down that treatment pathway to alleviate that autoimmune condition. Now, again, remember, there's an autoimmune component that's triggered by a stressor, and the thought process here that it was either from Lyme or it was from the mycoplasma that's setting the stage and triggering that ongoing inflammatory response. But of course, the gluten, the dairy, the deficiencies, all of those things can play a role. So we're addressing all of them at once. We're looking at the big picture. What we did is we actually put him on a gluten-free, dairy-free diet. We supplemented the deficiencies, emphasized foods high in low nutrients. I do not want people to be on a handful of supplements their entire life. I want them to be getting their nutrition from food. That can be difficult in today's day and age, so sometimes we need to use supplements, but it can be a game changer. And then we actually made a customized amino acid blend. So with the testing I'll show you here in a minute, we can actually look at what deficiencies he has and how much he needs in addition to what he's currently getting and make a customized blend, and that's what we did. We also supported detox, a big problem with autoimmunity and inflammation, added probiotics in, and then actually did a 21-day trial of azithromycin. Now, I know this sounds a little bit funky, being that I am a functional holistic doc, but I am not opposed to medications when they are warranted. And when you've got a child who has been on antipsychotics and multiple antidepressants, who is being admitted to a psychiatric hospital, we knew that we needed to be aggressive about his treatment plan. So we did a 21-day trial of azithromycin because of the active mycoplasma infection. Follow-up, just had it the other day. This is a new case. This actually was only over a 3 to 4 month period of time. This is what his parents said. We have seen a lot of improvement. OCD and tics dissipated significantly. Tingling, burning sensation in groin nearly gone. Rage episodes are significantly better. In his medical symptom questionnaire, the score we initially had was 55. At this follow-up, he was 17. Now, this kiddo, just like most people with autoimmune issues or immune dysfunction, it is not out of the woods completely at all. He's got a long ways to go, but this is a significant improvement considering what he has been through and what his parents have been through over the last 6 years trying to get to the bottom of this. So again, you have to think outside of the box. You have to take a full body approach and believe in the body's ability to heal, because it's magnificent what it can do if you just add in what it needs to thrive and take away the things that hold it back. So what is our approach at GrassRoots? We listen to you. That is the big part of it. Our initial intake is 80 minutes long, and it's literally a history-taking session. That's the majority of it. And I also have you fill out 15 to 20 pages of information, because I want to know exactly what you have been through from the moment you came into this world to the moment you're in my office, so we can pinpoint those triggers that set the stage for dysfunction. We want to look at the whole picture, and we want to order the right tests. So that is another, the key factor to functional medicine is ordering the right tests. And a lot of people just don't do this, and it kills me because they spend so much time guessing. It is worth the investment to get the right tests so you can make progress and you can get out of the woods and promote healing and enjoy your life. Every day you go by and you let your symptoms get worse or you ignore what's going on is a day closer to permanent, and we have to intervene before it gets to that point. So I just wanted to quickly show you some of the functional medicine testing, the top 2 tests that I recommend in my practice. This one is called the NutriVal, and these are foundational tests. A lot of people get these because when we're starting from scratch, my go-to is focusing on nutrition and focusing on the gut. Of course, we can get out into secondary problems pretty quickly depending on the history and what's going on, but these are tests I feel that people need to be getting. This is the Genova NutriVal, a great test. It's blood and urine, but it looks at all of those foundational elements, looking at antioxidants, looking at B vitamins, looking at minerals, telling us not only what you need to be getting, but how much more you need to be getting from what you're currently getting, for all of these nutrients on this summary page. It also tells us about fatty acids, digestive enzyme support, probiotics, pancreatic enzymes, and we're looking at those amino acids as well. This is just a sample report. My favorite part of this test is this section, though. For each nutrient, it tells you where you're at. It tells you what that nutrient does, reasons it can be low, what can happen if it's low. And then with these purple triangles, you can see how to get these nutrients up from eating the right foods. So always honing back in on that dietary approach to get these nutrients where they need to be. This portion of the test is the Krebs cycle. Again, a fancy set of pathways that look at how you're taking food and converting it into energy. You may remember this from high school. Most of us learned about it, and then it was in one ear, out the next, but very important stuff that now we evaluate every day because the environment and the diet play a big role. This also tells us a little bit about what's happening in the small intestine with bacterial overgrowth or fungal overgrowth, neurotransmitters, vitamin markers, cellular and mitochondrial metabolites, a big problem for kids with fatigue, energy problems, autism, neurotransmitter imbalances. Mitochondria, those powerhouses. So if those are dysfunctional, none of your cells are going to be healthy. So you really got to pay attention to those and support those appropriately. Amino acids, and then all of the fats, 3, 6, 9, good fats, bad fats. It also looks at antioxidants like glutathione and CoQ10, minerals, and then heavy metals. So that's one of my favorite tests. And then another test here I'll just show you that's good to consider when you're looking at dealing with autoimmunity is a comprehensive stool test. This is GI map test, and it's from and it's a DNA-based test. So a lot of tests out there are culture-based. The problem with the culture-based test is sometimes things just don't grow in the culture, which makes you miss a lot of different pathogens. So you can see here you're looking at bacterial pathogens like C. diff and Shigella and Salmonella and Yersinia, parasitic pathogens, viral pathogens, H. pylori, beneficial flora, looking at where the good guys are. And then opportunistic bugs like I mentioned before, that if they're too high, they can be a problem. problem. And then when we're dealing with autoimmunity, these are individual organisms that are associated with autoimmune conditions as triggering autoimmune problems. So this is so important to look at, because a lot of times we'll see these bugs come back and they will correlate with a specific condition. Symptoms improve a lot of times when you address them appropriately. Fungal overgrowth, viruses, protozoa, worms, and then digestive health markers, looking at inflammation, immune function, and detox, and elastase and steatocrit for breaking down the food and digestion. So functional testing goes a long way. Again, we want to be thinking, this is the pyramid to optimal health that we focus in on. At the very foundation is energy and mitochondrial function, detoxification, brain health, and mindset. Can't say enough about mindset. That is absolutely essential. Diet and digestion, stress and inflammation, and then lifestyle and environment. We have to, you cannot get here to a state of health without addressing these guys here. So make sure, again, you're taking care of that foundation. You're working with someone who can really take you through each step, because it's so important. This is our framework that we use at the clinic to help people get to the state of adaptation, which I'll explain. A lot of people come in with multiple symptoms. They're frustrated, they have pain, they're confused, they've been to multiple doctors, they're not seeing any progress, their labs are all screwed up, and they're just looking for a path to health, a path back down. They're looking for clarity. So that's what we're trying to achieve in that first couple of visits, is getting to a point of clarity. And we do that through that comprehensive timeline map that I told you about. It takes 80 minutes. We lay out everybody's history. We really prioritize what's been going on and what may, or what we call that as the crisis matrix, lead to dysfunction. And then we're looking to find some answers. And we use that functional testing and conventional testing to really paint that picture to see what's going on. We want, at that point, once we know what's going on, our goal is to get you feeling better. We want you to move better, think better, sleep better, so your body can heal and get back into that state of balance. And once you're there, once your symptoms have subsided, then we want to accelerate and optimize the healing process and start promoting more of those long-term habits and those long-term behaviors that are going to sustain health, so you can get to this elevation stage, which is when you have restored your adaptation response. And your adaptation response is your ability to come into contact with stressors from your environment and not completely break down. But a lot of people come down with come into the clinic with maladaptation, meaning that they are just broken. Everything they do seems to get them in trouble. And that is not how you should be living. That is not how you need to be living. But if you just go with Band-Aid solutions and you're just throwing medications on board that are covering up symptoms and not addressing the root cause, you're never going to reach that state of adaptation that we all need and deserve. This is just a quick overview of our program. We have a couple different programs that we implement, anywhere from 3 months to 12 months, depending on what's going on. But we work with you very closely, and we are optimizing. You're working with myself as the practitioner. You're working with a nutritionist, a functional medicine nutritionist. You're working with a health coach, and we're following up very often, especially in the beginning, to get you to that state of stability, so we can move forward and get you to where you need to be. But this is a process that is ongoing. Even when we get you feeling better, you need to be sticking with the routine, sticking with the plan, so you don't backtrack and get into the same situation again, which happens unfortunately all too often. So this is my family. I just like to show people this is my reason for doing the things I do. This is why I spend more money on food, the right food. This is why I exercise. This is why I detox. This is why I make my health the priority, because I want to be around to walk my daughters down the aisle. I want to see my sons hold their babies. This is the reason why we work so hard to stay healthy. And I think it's important for each and every person, whether this is you or your child or a family member, to be thinking about what are you going to do if something happens with your health, or if your health doesn't recover? What are you going to miss out on? Because I think we always need to be thinking about the future, always need to be looking forward to what is going to drive us and motivate us to stick with the plan, because this is not easy. it's much easier to pop a pill than it is to change your lifestyle. But popping a pill is not going to give you long-term results. And, you know, again, a lot of people come in with specific symptoms, but by taking a functional approach, by reducing inflammation, you're doing more than just taking care of those specific symptoms. You're also reducing your risk of developing other inflammatory conditions. And if you guys look at the mortality rates, you know, in the United States or worldwide, what is killing people is chronic preventable disease. So we need to change our mindset. We need to change our priorities. We need to change our thought process and our medical model and start figuring out why people are becoming sick and addressing the why, so we can get out of this rut that we're in. Just want to end with one of my favorite quotes. Indian proverb that says, a healthy person has 1,000 wishes, a sick person only has one. So that's just a little food for thought, again, to make sure you are doing what is important to keep yourself healthy so you can care for your loved ones and be with your loved ones for years to come. So I hope you found this talk valuable. I hope you guys have a great day. And again, my name is Dr. Seth Osgood, and I'm with GrassRoots Functional Medicine. We have, again, clinics in Austin, Texas, and we have a clinic in West Lebanon, New Hampshire. And I hope you guys find optimal wellness or are experiencing optimal wellness. But if we can help in any way, feel free to visit us on our website, grassrootsfunctionalmedicine.com.